An ambulance screeches to a halt in front of a hospital. They rush into the ER with a patient in critical condition, frantically calling out for nurses, but no one comes to their aid. All the nurses have quit because they burned out. Hello, my name is Emily Worth, and today I will be presenting Killing Our Caretakers, my solution for nursing burnout. Today I will cover burnout, what's the big deal, current solutions, recharge rooms, the need, and a conclusion. So what is burnout? Nursing.org describes it as nurse burnout is a physical, mental, and emotional state caused by chronic overwork and a sustained lack of job fulfillment and support. Here are some causes of burnout. Nurses work long hours. Most nurses work a 12-hour shift, and during this shift, they're doing things like administering medications, moving heavy equipment, and constantly going back and forth between patients doing checkup runs. Next, nurses take care of a lot of patients. Nurses provide care for more patients today than they have in the past. This has led to an increased level of stress during their shift. Last but not least, nurses witness death all the time. Since they've developed bonds with many of these patients, they often feel these losses very personally. Here are some symptoms. First, being tired. And this is more than just staying up late. This is a bone-weary exhaustion 24/7, even after a full night of rest. Next, there are a lot of physical health problems that can come from burnout. For example, when monitoring machines, listening for alarms, pages, and sirens all the time, nurses can suffer from sensory overload. Next, losing motivation. Nurses will begin to associate the job with stress and anxiety and overall feelings of unhappiness, and it leads them to not want to go into work anymore. Last but not least, stress. Nurses struggle to deal with the stress of handling all of these emotions on top of their responsibilities with their job. So what's the big deal? Why is this such a big problem that we need to fix? Well, there is a national nursing shortage, which has led to an increased patient-to-nurse ratio. Nurses are having to care for double or sometimes even triple the standard number of patients. Aside from those two reasons, in general, we want our nurses to have good well-being. These are the people that take care of us in the hospital when we can't do so ourselves. The least we can do in return is make sure that they're taken care of too. So, what are the current solutions? What's already out there to help nurses? We have some hospitals that will offer free counseling, which is wonderful because it means the nurses don't have to pay out of pocket for it. In addition to that, there are the normal coping methods like going out and socializing with friends and going and getting exercise. Recharge rooms. This is what I'm proposing we implement. These are relaxing rooms filled with things like massage chairs and books, but most importantly have a peaceful and quiet environment. Nurses can go into these rooms and take 15-minute breaks, and there are no pagers and phones allowed so that these nurses can have complete, uninterrupted relaxation time. How likely is it that we're going to be able to put these rooms into practice? How achievable is it? Well, the good thing is that these rooms are very easy to implement. All hospitals have to do is dedicate a room and put relaxing things in it. However, putting relaxing things in the rooms is where the cost comes into play. As I mentioned before, some rooms have things like massage chairs, which are not cheap. However, the silver lining is that you don't have to fill a room with the most expensive and fancy things on the market. Simply dedicating a room and filling it with maybe some chairs is perfect. The key thing with these rooms is that it's a peaceful, quiet environment that nurses can go into to relax. The need. Why are these rooms better than all the other solutions currently out there? First, they're very easy to access. All a nurse has to do is walk down the hall and jump into the recharge room. Next, they provide immediate relief. With counseling, a nurse has to make an appointment days out, and they can't get immediate relief. With these recharge rooms, as soon as a nurse is feeling overwhelmed and too stressed out in the hospital, they can walk up to the head nurse and say, I'm going to the recharge room, I need a break, and immediately have that opportunity to relax. Last but not least, it's a very simple process to get into these rooms. Nurses just have to walk up to the head nurse or the person in charge during their shift, hand in their phone and pager and say, I'm going to the recharge room, I'll be back in 15 minutes. In my research, I came across the Cancer Treatment Centers of America at Midwestern Regional Medical Center, and they actually implemented a recharge room. In the course of 1 month, it was used over 420 times. It became so popular that nurses were signing up in advance. 96% of the nurses who used the room reported they were feeling better and happier about themselves and about their job. This just goes to show how effective these rooms could be if they were implemented. I propose that we have every hospital put in a recharge room so that all nurses have the option of having one of them. Today I have covered what burnout is, what's the big deal with burnout, the current solutions, recharge rooms, and why they are needed. Here are my sources. Here are my photo credits. Thank you for listening. I hope you all have enjoyed my presentation.